This is Black Mental Health Matters. I'm drkerryann Williams. I'm a psychiatrist practicing here in Massachusetts. And this is a podcast about everything related to mental wellness in the Black community and beyond. Here in Massachusetts, we have William James College, which offers degree programs in psychology, counseling, and leadership. William James is specifically focused on developing leaders who will be the change that they want to see in the world. And so today I'm going to be speaking with a couple of graduate students from William James College. And the topic today is on emergency mental health services, specifically youth mobile crisis interventions. Generally, if you have an emergency here in the United States, you should call 911. Here in Massachusetts, if the emergency that you have is mental health related, you may have other options in addition to calling 911. So first, I want to introduce you to Lucy Andino. Lucy has a degree in sociology from UMass Boston and is now a first-generation graduate student at William James College, pursuing a master's in clinical mental health counseling, specializing in family and couple psychology, and is part of the Latino mental health program. Her plan is to continue on towards a doctorate in psychology. The next student that's joining me today is Natalia Vasquez. Natalia has a degree in psychology from Worcester State University, and she's a fourth-year clinical PsyD student, almost finished with her doctorate in psychology at William James College. Her work focuses on the Latinx population, medically vulnerable individuals, and individuals with complex trauma. She currently works as a weekend youth mobile crisis clinician for an agency here in town, and so she's going to speak from experience about mobile crisis services. So welcome to the show, Lucy and Natalia.
Thank you for having us.
Thank you for having us.
So I'm going to start with you, Lucy. Tell me a little bit more about yourself and why you're pursuing a doctoral degree in psychology.
Sure. As you stated, I'm a first generation graduate, and my background come from being raised in the foster care system and having the supports of mental health counselors has been a great thing in my life, and it's something that I always felt was very useful to me personally, and it's just very important. Continuing on into my doctorate, I really want to get into testing because there is, unfortunately, a very long list of folks that need to get tested, and there aren't enough clinicians in order to do that and make it smaller. So, and just the passion for families and teenagers, wanting to help them to get to better places. It's really important to me.
Great. And so, Natalia, how about you? What is your background and your motivation?
Yeah, so my family is Chilean. So they immigrated from Chile to the USA. I'm a first generation college student as well, first one in my family to also pursue a graduate degree. I do have a passion for giving back to the community and providing services, which is why that's kind of the focus in my degree. I do hope to kind of work with medically vulnerable populations, offer services in Spanish. I'm definitely interested in testing and plan to kind of pursue that, but I'm also really passionate about my current dissertation, which focuses on the perceptions of the Latinx population for psychedelic-assisted therapy as a treatment for chronic illness. So I kind of hope to pursue that further once I graduate.
Oh, that sounds really interesting. And so we're going to be talking today about youth mobile crisis interventions. How does a mental health emergency line differ from calling 911?
The difference is calling 911. Those emergencies are for medical emergencies, life-threatening emergencies, emergencies that have to do also with the community, whereas calling crisis is directly, you're connected with a counselor that'll be able to help you. It is strictly mental health related.
Yeah, I would like to add on to that as well, too. Historically, 911 used to respond to mental health crises in the community, but that kind of shifted when Massachusetts kind of passed a law, I believe, that kind of transferred the power to community-based services instead. So Massachusetts is split up into different catchment areas, so different teams can kind of are able to assess and help out the communities appropriately. So it's not just kind of like 911 itself. And typically, who shows up is a clinician, as well as sometimes a family partner or a peer specialist. And it's very much like evaluation based and resource and service based compared to 911, where it's like strictly de escalation. We do offer that as well, but it's a little more of a therapeutic service compared to just like strictly de escalation.
Okay. So when people call 911, they're going to end up having like a first responder, like a police officer or a fire, kind of the fire department showing up. But if they call this mental health emergency line, they're going to get connected to people who actually specialize in mental health that will have a better sense of how to be helpful for that mental health crisis.
Exactly.
And so for youth, there's a special youth mobile crisis intervention team. What is that?
Yeah, so the difference with that is really that we wanted to split up the age groups for kind of the large amount of catchment area and towns that we cover. So I'm speaking just from kind of my catchment area specifically. We cover 32 cities and towns, and that's not even covering all of Massachusetts. So we cover the Metro West area and then also Waltham area as well too. So we work with advocates who they cover 21 and up, and we cover everybody who is 20 and under. So that's how we're able to kind of get a lot of groundwork and are able to kind of conduct a lot more evaluations at a more like efficient pace.
Okay. And so if someone's at home and they're thinking, I'm not sure, should I call 911? Should I call the crisis? What warrants a crisis evaluation? How do they know that they're calling the right number?
I would honestly say that it really just depends. Typically, what warrants a behavioral or a mental health kind of crisis evaluation is either like a first episode of psychosis. It could be like a child that is extremely dysregulated and is having an outburst that is both physically and verbally aggressive, and there's like no redirection available to kind of help calm that child down. It can also be a loss of providers in the community that kind of leads to a worsening of symptoms that are already at play. But there's no wrong answer in whether you call 911 or whether you call us. If you call 911, it ends up being a mental health crisis instead. We work really well with 911 operators, and they very much like can screen out the calls and transfer them to our call center like directly. And same with us, like if we get a call and it's escalated beyond our control, we also kind of transfer to 911 operators appropriately as well.
Okay. So it sounds like people shouldn't worry too much about whether they're making the right decision in the moment, because especially in a crisis, you might not really even be thinking clearly. So if you call 911, it's fine. They will transfer you to the right people. If you call mobile crisis, but you need a 911, it's fine. You'll get transferred to the right service, basically.
Yes.
Okay. And so do we know anything about who this service tends to benefit the most? Like, what are the populations that are using this service?
Yeah, I would say that it's predominantly underserved communities, so communities that lack a lot of funding. I've responded to a lot of calls in like Section 8 housing, group homes, foster homes as well too. I do see a lot of people of color. That's a huge chunk of our population is people of color. Right now, those with immigrant status, undocumented as well. There's been a huge increase in that too. So it's a wide range in that regard.
Now, are there any downsides to using this mobile crisis line, this alternative to 911? Are there any barriers or concerns that come up with using this number?
So, just a few to mention. So, things like insurance, though crisis assessments are voluntary, um, folks who struggle with insurances can struggle being seen in a hospital. but also there are some setbacks in crisis.
Just to kind of add on to what Lucy's saying, that insurance definitely does play a huge role. I would say it plays more of a role for what we can provide after. Whether you're insured or uninsured, crisis will always see you because it's a community-based service, so we don't turn anybody away just because they're not insured. But it does play a role in what we can offer after, in terms of whether they need a higher level of care, whether they need kind of ongoing, like a partial program or an outpatient therapist. It really limits what we might be able to provide. And so it kind of ultimately feels as if the evaluation didn't come to the conclusion that youth may have wanted, because they're evaluated and then they're like, all right, our options are super limited. I would also say too, we do have a lot of communication with like ED, emergency room departments. And so the goal of youth mobile crisis was to kind of reduce the ED influx. So like not a lot of kids are waiting in the ER and taking up kind of hallway space or feeling overstimulated. But sometimes there's a lot of back and forth when assessing a level of care. So, sometimes a child's like jumping from the ED to a community clinic and kind of so on and so forth, which ends up kind of creating a barrier on our end and also the hospital's end for kind of what services can be provided. And I would say lastly, I know Lucy was able to kind of sit in on this meeting with us too, is schools. They very much are kind of our number one when making a crisis call. And there's often the biggest communication lies with the school's use of crisis, because oftentimes they're so underserved and underfunded in their own resources that they ultimately use us as a daily resource when it might not entirely be necessary, which creates a barrier on kind of how do we delegate, what's a mental health crisis and, what's a behavioral outburst that can be addressed maybe another day. So that also comes into play too.
And just to jump in, someone who was new to learning about crisis, there was a lot of talk about burnout, just due to the influx of calls and then the clinicians who are on staff at the time. So they go through such a process of wanting to be there and helping all these folks, but also just because of the rates of how they're being used, burnout's pretty high.
I imagine that, kind of trying to see the difference between what's a fully fledged crisis that requires a team to come in versus what is a significant mental health incident, but not having the staffing or the resources to manage it, could lead to some additional use of this service, thinking, gosh, let's bring in the professionals because we don't really have the infrastructure to manage this. But I also imagine it helps with the risk involved. If we're thinking that this is a high risk situation, maybe the behavior is a high risk situation, the thought is let's bring in a crisis team to help to mitigate that risk. And so we know that sometimes people call 911 when there isn't an emergency. And so it's not a surprise that people might call this a mobile crisis line when there isn't really a mental health emergency. So are there other times where, people call this line when there's really not, maybe their mental health needs, but that's not emergent? How is that managed? And how does kind of the misuse of crisis calls impact the evaluation and the services that come after?
Yeah, I would say that we are fortunate enough to have like such a really good call center and care coordinators. I think they're really kind of like the backbone of the whole entire team. And they delegate the calls very well to kind of assess what requires an immediate evaluation and, what doesn't require an evaluation and maybe requires a transfer to a 988 number. And then what maybe does require an evaluation but can be scheduled out. That's also another difference between us and 911 is that you don't schedule out a 911 visit, but you can schedule out a crisis evaluation. So that's what's really helpful with that. I would say, though, sometimes with schools, they are really just kind of covering their protocol on their end to kind of assess risk, and we completely understand that. Sometimes, though, there is a lot of pushback with them not allowing the child to return back to school until they seek a crisis evaluation. So it puts like the family in a compromising situation, it puts the school in a compromising situation, and then it ultimately kind of puts us in a compromising situation on kind of, okay, how do we address this while also making sure like we're not damaging rapport that could be created for a community service. So I think that those are all kind of elements that play into that.
So, are there any disparities in the use of this kind of service? Do some people that need to get it not have access to it or not really know about it?
I would say there's a big one with like a language barrier, because oftentimes, if for example like schools or maybe sometimes even group homes, clinicians there, staff there at schools as well too, they don't always speak the language of the youth that needs to kind of be served. So they oftentimes the family like lacks understanding of like services that are out there. Same with clinicians too. We don't have as many clinicians that like speak many languages, and yes, we do have phone services like language line services, but it's ultimately not the same, especially in a crisis. And so that kind of creates that ongoing barrier. As well as kind of going back to the insurance based issue where we can do a full evaluation and kind of help de escalate and stabilize in the moment. But if their insurance doesn't match anything for resources that come after, it does ultimately feel like, they're stuck where they're at.
And just to add, there's also some disparities in the sense of getting access to be able to go to the center and get your child an assessment. Parents have to take the day off of work or, find a way to get there. But, they love their kids, so they'll do what they need to do in order to help them.
Yeah, and that's really important because, there are certain kinds of jobs that don't afford parents the ability at the time to just kind of not work and bring their kids to receive services at the drop of a hat. And so that does, as you mentioned, create a disparity in who's able to leave work to be able to bring their child for services, and who isn't able to follow up. And so, do you guys have any possible recommendations or ideas that may help address disparities?
I worked at Boston Collegiate Charter last year, and in the school system, they do not rush to go straight into having children be assessed for crisis. They do a lot of de-escalation work in the school, so that they are aware of what's going on with the child, and also they have conversations with the parents before it gets to a level of having to call crisis. Also having things in place like safety plans if a child is feeling that they're going through a crisis and that they need help, and which is also good for both the parents at home, but also the educators.
Anything else you guys wanted to add on that?
I think on my end, I'm really just encouraging people to stay informed. I think the biggest thing that I see is when I go to an evaluation is lack of information that's handed down to the client or the family. And these are very much resources that are available online. You can give, your local clinic a call if you have more questions. Like, don't be afraid to get more knowledge because knowledge is power about this. And I hate seeing families at a disadvantage for a system that is here to aid them and not kind of create a further barrier for them.
And so, this has been a great discussion on the Youth Mobile Crisis Line. I think you provided a lot of really helpful information for people, and we'll make some information available also in the description for this podcast. is there anything else that you want our listeners or viewers to know about mental health services, emergency services for youth? Anything that you didn't get to say earlier or just wanted to add?
I really just think that it's important for folks to be aware of the resources that they have, and also knowing the resources that they have, how to use them properly.
Yeah, that makes sense. And I think it sounds like that's what you guys have been working on, is trying to make sure that people have the access that they need, and that the word gets out. And so at the end of each show, I like to ask guests to share 5 things that they do to support their own mental health. So if each of you can share maybe 2 or 3 things that you do for your own mental health.
Yeah, absolutely. For me, I like to get lost in a book that's not educational. Definitely clears your mind, and it's really good for self-care. Also, I have a pet that I devote time to, so that also brings me a lot of joy and peace. And music. Music is everything to me, and just being able to kind of drift away with headphones. Definitely useful, especially in the line of work that we're in.
Great.
Yeah, I think on my end, I have a puppy, may or may not have heard in the background. So he very much takes up a lot of my time in a very positive way, which I think is awesome. And I also love to cook. It's a great way to kind of bring family and friends together, and I thoroughly enjoy kind of providing a meal to somebody that I care about. So it's been really helpful for me.
All right, great. You guys have been a really wonderful guest. Thank you for coming on the show. And where can people find more information about Youth Mobile Crisis Services? Where can they go? Any websites or resources?
Yeah, if you're in the Metro West or Waltham area, please check out Wayside or Advocates. There's an MCI tab where you can get our call information. Vinfin and Elliott and Riverside are also other crisis teams that are available in Massachusetts. So please just kind of on the website, type wherever your town is and look for your local MCI.
All right, thank you. And for those of you out there listening or watching, if you have a crisis, please use the crisis lines. The show that we have today is a pre-recorded show. I do not respond to emergencies. Please use the websites, the phone numbers that we talked about today. And if you have questions, thank you for listening and thank you for watching, and have a great week.
Thank you so much for having us.
Thank you for having us.